Bismillah ar-Rahman ar-Rahim. My name is Zubair Ullah Sharif. By profession, I'm an engineer. My age is around 51 years. Before surgery, my weight was around 134. And I had a lot of health issues like BP, sleep apnea problem, and walking problem also, climbing stairs and all. I had a lot of issues. And BP was, I had a BP since 2008. That was, BP was around 140 by 100, 140 by 100. In spite of me regularly taking the medicines also, BP was not coming down only. That was constant, it was 140 by 100, 140 by 100. Now alhamdulillah, after surgery, BP is now become normal. And I had this snoring problem also before surgery. If you could see me my before photograph, I was like this. Just imagine 134 weight, and any jackets and all I used to never get. It used to only 4XL. All my jacket size, pullover size were all 4XL. I used to never get my ready-made items, garments and all. I had to be tailor-made only. All the garments used to be only tailor-made. And I had severe snoring problem. Because of this snoring problem, sleep apnea problem, I used to, whenever I used to go to Friday prayers, I used to go in the last to the masjid. Because I had a serious snoring problem and serious sleep problem. The moment I sit for 2 minutes, I used to go for sleep. I just sleep off. And in the sleep, I just start snoring. Everybody can see me, make a lot of. The snoring was such a heavy that even if I'm sleeping in some room, in some building also, easily the roadside walkers can make out, yes, this is Zubair is sleeping here. That way the snoring thing was there. So heavy, such a heavy snoring was there. And one of my friend, he had got it surgery done in 2013. That time he told me, come, you also get it done this surgery, and it's very helpful for me. See, I am just how I was and how I am now. I told him, boss, no boss, surgery and all not possible. I was a little scared, the surgery means generally and a human tendency, our Indians have got a tendency that surgery means, oh no boss. Surgery as if, oh no, not under any knife, not under knife. I was also the same kind of thing, no. And I tried other alternatives because there were plenty of alternatives are there available in our country. So I tried plenty of 5 to 6 alternatives also. I went to the slimming centers, 2-3 slimming centers. I went to the dietitian plans, dietitian things. I used some medicines, powders, everything, other things. I don't want to mention any names. That is not discussing regarding any mention any name. I tried myself because nobody forced me. All those things. I tried myself. I tried to reduce myself by without surgery, but nothing. Everything got in vain. Only I lost my time and my money. Other than that, nothing. Nothing was helpful for me. Neither my sleep problem was changed, neither my snoring problem had gone, neither my BP was normal. After that, later on, I just met through one of my friend. I just met Dr. G. Moinoddin. Alhamdulillah, when I came and met him, I was a little convinced. Since we are in a professional, we can easily make out the people, how the people talk. An opposite person, what he's talking, what his intention, we can easily make out. Whether it's a commercial and just a genuine person, we can make out easily. The moment when I spoke to this gentleman, I was a little convinced. I thought this gentleman is a genuine gentleman. This doctor is not a commercial doctor. He was not behind money. And I was convinced, and I said, okay, fine. And I was tired of all the other alternatives. So I finally said, no, let us go for it. So Alhamdulillah, believe me, trust me, Alhamdulillah, after the surgery, I am totally 100% fine. Fully satisfied. My snoring problem is gone, my BP is normal, my sleep apnea is gone. No more, I don't use any, after surgery, I am not at all using my CPAP machine. I just kept aside, thrown out the CPAP machine. it was a very embarrassing situation. And while I sleep, everywhere it was uncomfortable to sleep. While sleeping, you can just see that mask, wearing the mask, and the pipe running, a hose pipe running, and next to you is a machine. And nobody should sleep next to me because of that. It was such a this thing. But Alhamdulillah, after the surgery, everything is normal. Now I could climb easily 5-6 floors easily, and I can walk around 5-6 kilometers easily. 1 year we had to strict medication, and the first 3 months diet, say first 6 months dieting thing, say strictly dieting followed. Then later on, now Alhamdulillah, after 1 year, normal, like how normal people we have a food, I have the same food, everything is same. But nothing, absolutely nothing. Now I'm saying such about this thing, concerned about others also. Like I don't want others to waste their time and money like me, how I wasted. So whenever I find I come across any obese person on the road, I just stop my vehicle and just meet him and talk to him, introduce myself and talk to him and make him understand what exactly it is. I just tell them, boss, the life is very short. Whatever the God has given this time, you have to enjoy this time. For that, you have to be hale and healthy. This life is so that we also enjoy our life, and we have to help others also. For that, first we have to be healthy. If we have to help others, we have to be healthy. So for that reason, best was to immediately go take an appointment, fix an appointment with Dr. G. Moinoddin at Manipal Hospital Millers Road, and get your surgery done. Absolutely, you will transform your life completely. You will just be thankful to God, and you will be thankful to me also later.
Hi, I'm Dr. G. Moinoddin. I'm a consultant bariatric and advanced laparoscopic surgeon at Manipal Millers Road Hospital. So today I want to discuss a patient profile by name Zubair Ullah Sharif, a 52-year-old man. And basically he came to my OPD, in my clinic he has come. I can see him when he came, he was 138 kgs. And from the entrance of the door, he was unable to walk for few steps. He was complaining of too much of breathlessness and tachypnea and all the stuff. Then I felt something is wrong with him, because even though he's obese, but he can't have such an acute apnea. So immediately I admitted him in a hospital. Then I analyzed there is pulmonary embolism happened because of his obesity, which has formed a DVT, and the clot has thrown into the lungs, causing pulmonary embolism. So it was an acute emergency, so we have treated him. His embolism was resolved by giving him antiplatelets and all the stuff. Then afterwards he recovered well, but the underlying cause was obesity for all the issues. So after a month or so, after stabilizing him, we have done a bariatric surgery on him. So the patient profile before surgery was like he was 136 kgs, and he was having high blood pressure, and he was having obstructive sleep apnea, severe obstructive sleep apnea, for which he was using BiPAP machine to get sleep, and he was having loud snoring, and he was feeling tired all over the day, and he was unable to concentrate on his work, and he was having a lot of tiredness and all this stuff. So now is almost quite a long time post surgery. It's almost an year now. He's 78 kgs now. You can see his blood pressure has become normal, and he's out of the sleep machine, and the snoring has disappeared, and his quality of life is better. He can walk, he can do whatever he wants, and he can attend his meetings, and there is no more tiredness like before. And I can say that basically Zubair Ullah Sharif's quality of life has completely changed, and I think it's a new life for him. Thank you.